Breaking bones can take months to fully recover, especially with the elderly.
And a common injury continues to slow down the older population. Dr. Joseph Conflitti is here to talk about hip fractures. So it's kind of, the question is, does the fall cause the break, or does the break cause the fall a lot of times?
It's really hard to say. Some people think it is actually the break first and then the fall, because what happens in elderly people is that the bone is actually pathologic. It's not good bone anymore. If you've heard of osteopenia or osteoporosis, the bone is quite thinned. And so some people think just in the act of getting up and getting out of a chair or walking down the stair, the bone breaks and then the fall happens.
Now, it's amazing because if someone fractures a hip in a young age, it's not a big deal. I mean, obviously any broken bone is, but boy, it just seems like it's almost it's a life sentence to something terrible when an old person breaks a hip.
It really is. It's not just like a broken wrist or a broken ankle. A hip fracture in an elderly patient means an increased risk of blood clots, an increased risk of stroke, an increased risk of pneumonia. And so all those compile together, and then they're sitting in bed, they have weakened muscles. And so there's about a 30% increased mortality in the first year just from a hip fracture.
So what kind of things can we do to help prevent them?
The biggest one is there are now 3 different medicines that folks can take that have been diagnosed with poor bone. I have a model I want to show here. If we can zoom in on that. That's a femur, and the area that we're talking about is the top part of the femur right here called the neck. And the medicine that is available now helps to decrease the turnover rate of that bone. Some of them are daily, some of them are weekly, and some of them are monthly. And in fact, there's a new one now that may even be yearly to help prevent that rapid turnover of bone. If it happens, there are other things that we can do, obviously, with surgery, but we'd like it not to get to that point.
As so many people our hip replacement has become so common, is that a good thing for an older person to have to go through?
Well, a hip replacement could be done if they have a fracture, but a hip replacement wouldn't be indicated to prevent that fracture from happening, because usually hip fracture is for arthritis, and so that area on the bone is actually taken out for that reason. But if they did have a hip fracture, then we would actually do either a partial hip replacement or try to fix it with a rod or some screws.
All right. Now, if you have more questions for Dr. Conflitti, you can email us, primetime@cbs19.tv. You can also go to our website where we'll have more information and links to ETMC Orthopedic Center. Thanks so much for being here.
Thank you.
Appreciate it.
Appreciate it.